The lower esophageal sphincter, or LES, is a small but incredibly important ring of muscle located at the junction where your esophagus meets your stomach. Think of it as a gatekeeper, controlling what passes from your throat into your stomach. This muscle valve acts as a barrier, preventing the harsh, acidic contents of your stomach from flowing back up into your esophagus. When you swallow food or drink, the LES relaxes just enough to let it pass through, then quickly tightens again to keep everything in place. It opens to let food in, then closes to keep acid down. This process is usually smooth and automatic, happening every time you eat or drink. However, reflux happens when the LES is weak, damaged, or relaxes at the wrong time. When this happens, stomach acid and sometimes even food can travel back up into the esophagus, causing irritation and that familiar burning sensation known as heartburn. Pressure on your abdomen, like during pregnancy, after a large meal, or with extra weight, can force the valve open, making it easier for acid to escape upward. Even tight clothing or bending over after eating can increase this pressure. A hiatal hernia, where part of the stomach pushes through the diaphragm, also weakens the LES. This condition makes it even harder for the valve to stay closed, increasing the risk of reflux. The diaphragm, a large muscle that helps you breathe, normally supports the LES and helps keep it tightly shut. When the diaphragm is out of place or weakened, as with a hiatal hernia, reflux is much more likely to occur. Certain foods, drinks, and medications can also relax the LES temporarily, making it easier for acid to slip past the barrier. This is why some people notice their symptoms get worse after eating or drinking specific things. Caffeine, alcohol, chocolate, and peppermint are common triggers, but spicy foods, fatty meals, citrus, and even some medications can also play a role in relaxing the LES and worsening reflux. Understanding these factors is key to managing reflux. By recognizing what affects your LES, you can make choices that help reduce symptoms and protect your esophagus from damage over time. Next, let's look at the symptoms you might notice if reflux is affecting you, and how to recognize when it's time to seek help. Heartburn is the classic symptom, but reflux can show up in other ways. Regurgitation, acid or food coming back up, leaves a sour or bitter taste. Chronic sore throat, hoarseness, or a persistent cough can also be signs. Some people feel like food gets stuck or have trouble swallowing. Chest pain from reflux can mimic a heart attack. Always seek help for severe pain. Acid can even erode your teeth, causing sensitivity in cavities. Water brash, excess saliva, is another possible symptom. Recognizing these signs helps you connect the dots. If you have a mysterious cough or sore throat, reflux could be the cause. Let's talk about foods that can make symptoms worse. What you eat plays a huge role in reflux. High-fat foods, fried items, creamy sauces, fatty meats, slow digestion, and increased stomach pressure. Acidic foods like citrus fruits, tomatoes, and their sauces add to stomach acidity. Spicy foods, chili peppers, hot sauce, can irritate the esophagus and slow stomach emptying. Triggers vary. Pay attention to your own reactions. Chocolate, peppermint, and spearmint relax the LES, making reflux more likely. Onions and garlic, especially raw, can also be problematic. Keeping a food diary helps identify your personal triggers. Small changes in your diet can make a big difference. Next, let's look at habits that can worsen reflux. Managing what you eat is just one part of the solution. Your daily habits matter too.